Dr. Tremblay from USA, identifying poor metabolic adaptation during early lactation in dairy cows using cluster analysis. Let's start your presentation.
Good afternoon, ladies and gentlemen. It's my pleasure to be here today and talk to you about the work of my co-worker, Marleen Tremblay. My name is Dörte Döpfer. I'm here and honored to present our work about identifying cows that need veterinary attention because of what we coined poor metabolic adaptation during early lactation. And you can read the details about this work in a published article in JDS from this year. This is a collaboration between many institutions. We're going to be using data from the south of Germany, actually. And we coined this term, poor metabolic adaptation during early lactation, called PMAS, because we were not allowed to use the word ketosis by the reviewers of our article. PMS indications and characteristics are all the higher producing cows during the early lactation, mostly having a higher elevated body condition scores at the start of lactation. They seem to be struggling in terms of what their liver metabolism can be doing, as reflected by liver enzymes and elevated bilirubin values. And they have had a decreased rumen fill, decreased rumen contractions, and eventually their milk production would go down. So how did we arrive at this idea of PMS as a syndrome that calls for attention for cows that are suffering from this condition? Well, we believe that PMAS cattle, they have elevated NEFA, the non-esterified fatty acid values in the blood, and they reflect an inappropriate response to the negative energy balance at the beginning of lactation, with concurrent clinical signs, such as a bad rumen fill because of depression and less feed intake. In contrast to hyperketonemia, which is a normal physiological response to compensate for negative energy balance. And this belief has been created by the selection for high milk production. It's reflected by increased BHBA levels in the blood and associated with negative health outcomes later during lactation. So in spite of initial observations of PMS, actually, cows with PMS are commonly identified by detecting hyperketonemia. And we run into these contrasts between cows that have these signs of PMAS not having elevated BHB levels. And hyperketonemia doesn't manifest consistently with indicators of PMAS. And I think this has been described many times today during the different talks. So we set out and took a big data set from the south of Germany, actually, and characterized PMAS, or tried to redefine it using clusters of cows that had common symptoms or common values for milk fat protein ratios, for blood levels of BHB, and for the blood levels of the NEFA values. So blindly, using a machine learning approach, this is a data approach, we clustered the cows according to these three values and saw what happens. And we would like to really identify the best limit values for the best indicator out of those three in order to spot our PMS cows. So we had this wonderful data set, actually, and Dr. Plattner is sitting in the back. You can ask the details about the study, and you can look them up in that poster, which is NUP13. Please do that. We had data from 26 AMS farms in the south of Germany, in Bavaria, and they were enrolled for an average of six weeks, visited weekly, and then physical examinations between days in milk 5 to 50 were conducted, blood and milk samples collected, and we did our analysis using 790 observations from 309 Simmental cows out of a total of 312 cows. So you can see there's a plethora of possibilities of indicators for how to characterize these cows in different clusters. We withstood with 790 of these observations, and we had the BHB, fat protein ratio, and NEFA values. We used the principal component analysis to check where do these cows cluster according to those three values. And these clusters were then ascribed to low, intermediate, and high risk classes for PMAS, based on the degree of agreement between what we think are expected PMS indicators in comparison to the other clusters. And then we would try to see where are the limit values for those NIFA and BHB levels and the fat-protein ratios and compare them between clusters. What we found were 5 different clusters based on this kind of blind approach, and we assigned them to the low level, so these would be clusters 1 and 2, because those were cows with lesser milk production, lesser average lactation numbers, later days in milk, lesser liver values, less back fat, change in back fat, greatest rumen fill score, which is a better thing. Similar in cluster 2, and then our highest risk class for the PMS would be these 137 observations of cows that had the greatest milk production, greatest average lactation number, earlier days in milk. They had greater liver values and high back fat changes and back fat in general, and the lowest rumen fill scores. And then there's this cluster 4 that I want to draw your attention to for later, which is our middle milk production, greater average lactation number, earlier days in milk, middle liver values, high back fat, and middle rumen fill, similar to cluster 5. So what do they look like with regards to those 3 indicators? Look at our cluster 4 here. Whoops, I'm losing it here. This is our intermediate risk for poor metabolic adaptation syndrome, has a high BHB level, so there must be some ketone bodies are formed. In contrast to the other intermediate level cluster for risk for PMS, they did have low BHB levels. And then here's our high risk level, so these are the older cows at the beginning of the lactation with higher body condition scores and high liver enzymes. These are our problem cows. We really want to flag them based on their NIFA values. Blood NIFA seems to be the better indicator for flagging those animals that need veterinary attention because they really have clinical signs. So when we looked at our clustering, and that's what you see in these clouds of observations here, it's really the NIFA values that characterize our high-risk group. This is our cluster 3. And it's the BHB level here in cluster 4. This is our intermediate risk group for PMAS, in contrast to the cluster 5 that had very low BHB levels. So BHB is playing us that trick again of not really being the best clinical indicator for cows that need veterinary attention. And then when we looked back at our low PMS risk group, it really had NIFA values on average of lower than 0.39, lower than 0.4, I think is one of the limits in literature for lower for lower NIFA levels. And then the high PMS risk group actually had NIFA levels on average of greater than 0.7. And this is another limit value used in literature for flagging cows that have elevated NIFA levels. So somehow the story came together, and something that started out blindly with cluster analysis really came together with physiological parameters that are used for flagging cows with problems. So we did see this contrast between poor metabolic adaptation syndrome and the BHB measures in blood. We did see a ketogenesis, that is a normal physiological response to negative energy balance. And so this ketogenesis does not necessarily reflect a pathological change in the cow with clinical signs that need immediate attention. And we believe that it's important to distinguish between appropriate and inappropriate response to negative energy balance, and PMS is a reflection of this poor metabolic response to negative energy balances. So cows may compensate for negative energy balance in one of 2 ways, and this is from a publication by Klein et al. And one way would be by limiting milk fat and limiting ketogenesis. And that's exactly what our cluster 5, the intermediate risk group for poor metabolic adaptation syndrome did. They had a low milk fat, but no elevation of BHB, in contrast to cluster 4. Remember the other intermediate risk group for poor metabolic adaptation syndrome that had the highest BHB levels, as well as the highest milk fat, that was reflected by a higher fat-protein ratio. And then we still have left over our high-risk cluster number 3, and it did not show a decreased milk production actually, or the cows in those clusters did not mobilize ketones. So we believe that these high-risk PMAS observations relate to cows that have a non-appropriate response to negative energy balance, and they do need veterinary attention. We need to further investigate these negative energy adaptation mechanisms, that's nothing new. I think there is genetic heritability involved, and those cows should be genotyped. There is a potential for selection against poor metabolic adaptation syndrome, and we should come up with management strategies against poor metabolic adaptation syndrome. And I think one of the presentations about adapting the milking frequency would be a possibility. Treatment, of course, of cows by separating them, feeding them differently. Those are all management strategies that are thinkable. So in conclusion, we believe that NIFA is a better parameter to monitor and flag cows in need for veterinary attention. And we recommend these limit values for flagging the low risk and the high risk PMAS cows. And with this, I would like to finish and thank you. And if you have any questions, let me know. Thank you.